Hey, this is April, and this show, SetSet Show, discusses cannabis, psychedelics, and altered states of consciousness generally. It's intended for audiences 21 and over. Also, I am not a medical expert. If you are looking to engage with psychedelic substances, please consult your physician before doing so. Hi, welcome back to SetSet Show. I'm April Pride, your host and CEO of SetSet. Today, I'm very excited to introduce our guest, Joe Robinson, who is the founder of PsiloSafe, an organization that's just jumped ahead of regulation because as decriminalization of psilocybin products is on the rise, there is a need for standardized testing, standardized labeling, so that consumers can have their safest experience. You may be familiar what's happening with 4-ACO-DMT, which is not psilocybin, but is the active ingredient in many of the chocolate products and other products that are sold under the guise of being psychedelic mushrooms. And unfortunately, this year, there have been 2 deaths in which 4-ACO-DMT has been found responsible. So think of it this way. You have 4-ACO, which is a powder, and you've got fentanyl, which is a powder. And there is a cross-contamination that happens in a lab, an underground lab with people who don't care. And Joe and his organization do care. So they have products that are tested. Considering the headlines recently, particularly in California with cannabis and testing and dirty product, and then more and more reports of dirty product within the psilocybin space, I feel like what you have seen all along in terms of what PsiloSafe can offer consumers is what I'd really like to focus on today. Cool, great. So let's start with how we met, which was at Wonderland in Miami in 2020. You came by the booth for Set and wanted to show us what was up.
Yeah, it was just floating around like booth to booth. I get so bogged down sometimes and like my own agenda and like I had a booth of my own. Yeah, just being able to float around and make some networking connections and then coming on set and understanding where we had a lot of alignments, both personally, our former professionally, and then what we're doing now. So it was really a wonderful day, match made in heaven in terms of you and I helping each other from a networking perspective, but also from a potential business perspective at some point.
Huh. So then I think what attracted me the most is that you have a background. So once I saw the products that you were offering and the seriousness with which you took not only the SKUs themselves, but making sure that they were a quality product for consumers, we started to dig in a little bit into your background. So if you could, for listeners, I always like to ask people, like, why should we trust you? What's your background that really has contributed to the passion that you have to bring trusted product to this space?
Yeah, I think it's 3 things. I'm qualified because I've been in the medical profession for over 2 decades. I was on the big pharma side for a while, which for some people in this space are like, oh my God, the evil in there. And I get it because I was over there for a while, not feeling so good about some of the things that were happening on that side of the business. So I believe that working with sacred earth medicines suits me better, makes me feel better about what I'm doing. That medical background, though, regardless, it really helped me about understand different product classes and different patient populations or customer populations that are congruent with those classes. And it helped me understand the importance of education, especially in the field of psychedelics and other entheogenic products. It's such a new concept to so many people that creating the market is everything. And risk mitigation so that something bad doesn't happen and stifle our progress to date is another important thing. It's that educational component, understanding how to communicate benefits of medicine and also how to speak with specific patient populations or customer populations. Somebody with PTSD is going to be a lot different conversation than somebody with anxiety, for instance. So the healthcare background, I think, suits me well into this field. My company's a branding and marketing services company, so we don't manufacture anything per se. We just bring products to market, both for our own in-house portfolio and for some external customers that we do contract business with. Never claimed to be like an expert cultivator or manufacturer, and I don't look to do that. So I think another trust factor here is that we stick to our knitting in terms of branding, education, go-to-market strategy, training people to talk about these products on the front lines, and we'll stick to our knitting with regards to that. With regards to any of the materials that we have in our own in-house brands, they have been very highly vetted across some of the top producers in the US. Formulation, practices for formulation, different product categories. We've got a specialist for gummies. We have a specialist for tinctures. We have a specialist for medicated cacao bars. We have a few certified facilities for the raw fruits. Not like we needed to learn how to do this. We brought people in, and your margins are not as good, obviously, because you're sourcing second party white labels. But we believe that it's in the best interest of the end user to do it this way. We stick to what we know best. They stick to what they know best. About a year ago, we sat down and said, who's regulating this? And this is such an important time for psychedelics. What happened in the 60s with the Timothy Leary movement and creating a lot of awareness for this, but doing it in a way that was not very productive to the movement. And it set us back years with having these products in the market for mental health purposes. We want to make sure that doesn't happen this time. And while it is in this kind of gray area, some areas are decriminalized. There's been talk about legalization, blah, blah, blah. We're firm believers that decrim and descheduling is the only way. This is earth-based sacred medicines that have been used for thousands of years. We believe that the medical healthcare system getting involved, it doesn't match up. In our small healing communities and some of the decriminalized zones, Oakland, Santa Cruz, some parts
Seattle,
of Ann Arbor, Michigan. That, for those folks that are involved in production, in manufacturing, in any facet, the path to wellness, that there's got to be some type of oversight and regulation. And that's where PsiloSafe comes in as a self-regulating organization or an SRO to huddle those that are involved and say, what are our best practices? How can we mitigate risk? And what's the best go-to-market strategy with our products to make sure that the customers are receiving clean, safe, and effective medicine? So those 3 points, I would say, would be reasons why folks would want to work with me or work with our organizations, because we really are in it for what we believe are the only reasons. The psychedelic movement's great, but I think that getting involved with real healing initiatives and having community-based healing initiatives and working with the practitioners and the medicine and the facilitators and the integrators all together is really going to give us the best opportunity to maximize this next wave of the Renaissance.
So let's go back to the first reason, which is your background in pharmaceuticals. When you say you became more aware of different classes of drugs and also the different consumer groups that need, what do you mean by classes of drugs?
That is
Like pain medication
yes,
versus,
pain medication,
okay,
and health units, SSRIs.
okay.
Yeah, I'm not going to go down this rabbit hole too deep with you. I've got some
Sure. I just wanted to make sure that listeners understood what a class of drug meant. Yeah.
Yeah. So class of drugs. So a class would be pain meds, selective serotonin reuptake inhibitors, cholesterol drugs.
Sure.
Very widely prescribed and recommended. My issue with the pharma model is I don't see that it's working for an end point. I think it's a lot of management of symptoms with no addressing of the problem. And that's in the mental health space with SSRIs. For some people, they work great. I'm not going to downplay all of pharma and Western medicine, because I think that medicine has a very important part in all of our situations. As I said, I just fractured a clavicle 2 weeks ago. Western medicine, some prescription medications, some treatment protocols can work very well together. But there's also this whole side of the sacred earth medicine, plant medicines that have been used for way longer than any of this patented prescription stuff has. And there's a balance that can be met between the two. And so that's where I think we're trying to provide clean, safe, and effective medicines on this side of the fence that can be worked in conjunction with, say, some of those aforementioned classes. For me, I try to stay off of as many pharmaceuticals as I can. This is one of the most painful injuries you can sustain.
Yes. Yeah.
And I took 1,000 milligrams of Tylenol one day, but I was offered pain meds from my friends. I said, no, I'm good. I'll grunt through it. I've seen what's happened with the opiate class, for instance, and some of the benzos, limb that's been chopped off. I think I'm good. That's just me. I try to stay like on the naturopath side of things and find natural solutions. But yeah, so drug class, I would say the apps and Lycos bringing the FDA stage 3 to light, huge advancement. They brought a psychedelic class of drugs to the FDA. They have a wonderful protocol out there that seemed to be working very well. And as long as there's access to clean, safe, and effective MDMA in this case, there's hundreds of MDMA psychotherapists that are now trained.
Yeah.
Protocol, we've got clean meds,
Mhm.
we've got people. Do we need the FDA's nod on that? It seems to be working out pretty well. But to the point, bringing that to light and bringing that to the surface and giving people hope that this kind of gray market class will continue to be used as they are right now in the gray market and can start to get some notoriety, maybe some acceptances and approvals from the powers that be to make them more broadly available as a good adjunct or substitute to the classes of drugs that are out there already for mental health.
Yes, it's interesting having worked in cannabis. There are more studies in cannabis than there were 10 years ago when I first started working in that space. And one of the things that I found the most interesting, both anecdotally talking to people who grew their own medicine to treat health conditions. And I like to say that cannabis treats symptoms, whereas psychedelics can treat the root cause, right? And when you grow your own, the effectiveness, as reported by so many people that took the time to grow their own plants, was just night and day as compared to if you went to a store and bought it, right? So creating that relationship with your medicine allows the medicine to get to know you and to work in a way that is very personalized. That's fascinating to me. And so then on top of that, there's clinical research that shows that the closer the medicine is to the natural compound, the more effective it is, not only to treat the symptom or the root cause, but also the duration of the subsiding of symptoms. So it just is more effective, the whole arc of the experience. And so that, of course, must also be the case for natural psilocybin, right? The
Yeah.
closer to nature we are. And the only way for the pharmaceutical market or the pharmaceutical industry for it to work is if they synthesize something that's not the natural so they can have the IP on that, register it, and make the money that they need to make because research is expensive. And so we already know that we're going to be saying yes to an inferior product as soon as a natural compound is synthesized. I find that interesting.
Yeah. There's a study that was recently dropped, but it looked at the synthetic versus the natural. And from a therapeutic perspective, it's the organic that really comes up. And to the point I made earlier,
Mhm.
I'm a firm believer that plants and nature and fungi that are our God-given right should just be decriminalized and descheduled. Come on with it. This is stuff that can be produced in your backyard, or if you have a home kit and you're cultivating your own medicine and you're administering your own medicine and you're running your own show, that's a beautiful thing. That's real humans. That's real human. That's freedom.
Mhm.
I think synthetics and lab made stuff should stick with through the channels of pharmaceutical and FDA approvals and all that. But for the natural substances, it just doesn't make sense to put those products through the Western medical model. It's the Western medical model is really about a business. It's about an
Mhm.
institution. It's profitability. It's not really about customer, the patient in all of the ways. And I bring it back to when I was in pharma. I just found it very interesting that the drug discovery process involved marketing people and go to market people. And I was like, so much more important things that we could be going after than like boner pills. When Viagra came out, but you know what I'm saying? Lifestyle stuff out there that
Yeah.
this is great, but how many other people are suffering? Even like these like smaller patient populations for some of these rare disorders.
Mhm.
And you have to take it for what it's worth. The pharmaceutical industry is a behemoth, and the pharma industry and the government work really well together, and they're hand in glove. And there's a lot of good stuff that's being done there. But I regress back to the whole: just let us have nature out here in our own communities. There's a lot of very capable, passionate, interested people that are starting to emerge with the psychedelics movement that want to administer high dose mushrooms in the comfort of their own home. They're safe, they're vetted, they're experienced. low dose microdosing. I'm with the microdosing collective out of Los Angeles. Paul Austin is one of the founders there from Third Wave, and they're making a real big push to get that legalized. Home use of sub-perceptual psilocybin. There's such a small ask. And so it's being done anyway. And nothing's going to stop the
Right.
movement. So
It is being done anyway. As a person that's clinically backed information for me, and unfortunately, we just don't have the scientific evidence that microdosing does anything beyond placebo. I feel like in this, for the sake of protecting consumers, I mentioned this on a call with you before, that there is evidence that long-term use of psilocybin may create heart issues over time. And so having worked in the cannabis space and jumped the gun in terms of what we gave consumers access to before we really understood the consequences, I am very nervous about if we don't know if it could create issues down the road for cardiovascular concerns. We really do need more evidence before we ask our politicians to approve legislation. We just do, because that's a very slippery slope. I'm not going to disrupt the cause, but I think we have to ask more questions and have a lot of integrity when it comes to standing side by side with the science. So as much as I believe in what the microdosing collective is trying to do, because I've heard transformative stories from so many people that have microdosed, I wish that we could have these larger pharmaceutical companies working in the space fund research so that we can tell consumers what is going on for them. But right now, it's just like cannabis. We've talked to all these people. This is what's working for them, but we don't really have any longitudinal studies on it. I think consumers and listeners to this show should understand like what the science and what all the facts actually are, and then make your own decision. Because if you have a heart condition or your family has a genetic predisposition to some sort of heart condition, just like with bipolar and psychosis and other mental health issues, you need to know your family background before you say yes to psychedelic medicine. But it's beyond mental health diagnosis. It's also cardiovascular. We understand now too. So
I said high dose cardiovascular. I'm not sure that I understand the cardiovascular risk was.
yeah, so they're saying there is evidence that with repeated use of psilocybin over the course of decades, so people that have been taking it at any dose on a regular basis, that there's a thinning of the arteries over time. And there hasn't been a dedicated research study to this. There's only been preliminary evidence, people that go in and have heart conditions, and this is part of their history, their behavior. We just don't know. And yeah, I just bring these things to light because I want people who have the resources or a lab to do some of the research to understand, yeah, a lot of people are microdosing psilocybin. Can we get some answers for these people's stat? Really, that's all we want. So
Yeah. I think a longitudinal study on the mRNA vaccines would be more important at this stage. We have like hundreds of millions of people on that stuff, and I don't know that we have any data. And I don't know if there's a myocarditis situation there. So I think just in a prioritization perspective, I think that it's a little bit more nascent, or I'm concerned as what happened there in 2020, 2021. But I agree with you. Like, this kind of stuff needs to be studied. It's where does the priority go? I would think for the pharmaceutical companies, especially that made tens of billions of dollars off of that particular therapy, that like that would be the most important longitudinal study to put into play right now.
they're not going to do that. There's no way. Yes, I think that your thinking is exactly the right thing for the consumer, which is why we're lucky that you have put so much passion, time, and your own resources into SiloSafe. You wanted to get to answers too. So some of the headlines.
I'm not that worried about a longitudinal study for the heart conditions. I would think that for me and within PsiloSafe, when we're looking at different patients, so we would just recommend that if you have a history of heart issues or specific heart conditions, AFib or something else, that maybe you would not want to be the first line of treatment. Just like disorders, if you're on like lithium, or if like you've had like a history of schizophrenia or bipolar disorder, taking a high dose psychedelic, especially like in a solo setting with no upward and with no oversight, that's the potential for a disaster. I think with PsiloSafe, what we're looking at is three pillars. It's safety for the consumer,
Hmm.
safety for the manufacturer, and safety for the producer. And so with the consumer, it's to have a screening device, and we're working with someone that's doing a technology play to have a screener to understand who's in and who's out. For instance,
What does that mean? What does that mean, a screening device? Yeah.
some type of a screening tool, like an app or at least a survey. So
Oh,
like,
to screen themselves as a candidate.
yeah. And I think to your point, somebody that's got a history of a heart condition is probably somebody that we want to rule out until they get seen by a medical professional. Same type of mind or mood altering disorders or mind or mood altering, heavy mood altering drugs. Probably want to keep them off as well. Underage. We really stress the fact to the people that work with us is we're not in the business of giving kids drugs. And so making sure that the products and packaging are suitable for that and interesting to that customer segment is important, but that's another there. I think like from the practitioner and the facilitator perspective, like making sure that people are safe to work with, like they
Yes.
have a type of credential and they have some type of backing from other people. There are very weird people all over the world and some
Mm.
funky things can happen when people are under the influence of this stuff.
Joe, do you have any directed advice for people when they are looking for a facilitator? Maybe questions to ask or sites that they can start their search?
We're working with a couple groups right now that I'm going to just keep anonymous, but
Okay,
we're not in the business of vetting practitioners or facilitators, but I would say ask those to get a referral.
great. Great
Start slow,
advice.
use your intuition. That's the only way that I'll do it personally is if I have a referral that they work for
Mhm.
somebody.
And if
Yeah.
anyone's listening, you can DM GetSet on Instagram if you are looking
And,
for a referral. Yeah.
but intuition is everything too. If somebody's trying to get you to do something too fast or your
Mhm.
quick process or their technique or the way that they're communicating, yeah,
Yeah.
just
Yeah.
they stay away because there are some people that are more self-serving in this and they'll take advantage of people that are vulnerable. We also want to make sure that the medicine that you take is maximizing the situation that you can have. It's a big leap of faith for a lot of people to come and
Mhm.
decide psychedelics. Want to make sure that they're properly handled and they're properly cared for and the space is a safe one. And then the third pillar would be safety for the medicine. So that would be looking at cultivators, product manufacturers, and branding people alike, myself, and just making sure that the packages are labeled properly, with child safety, there's proper background information if you need to dig a little deeper with that manufacturer,
Mhm.
that material has been cultivated and produced in a fashion that is relevant for therapeutic purposes. We're talking about sentient fungi here in this case. They're very much part of us. They need to be handled as such.
Let's talk about that. That
Yeah.
is that's huge headlines too
Yeah.
in the last 6 months.
I wouldn't even see it's product safety, but it's also like the relevance of the product. The people that we work with, the people that are in the PsiloSafe network, they're cultivating mushrooms for therapeutic purposes. There's a certain way to handle them. There's a certain vibration that you want to have around them. Some of them are playing music. Some of them are
Mhm.
really caring for their fungi or plant babies in a
Yeah.
way is going to carry it all the way through the chain. And that's the way that they harvest. That's the way that they cure them. That's the way that they store them, the way that they're handled for post manufacturing. SiloSafe certified products are from spore to cure,
Mm.
uh, in a way that are relevant for this channel of therapy. So many therapists and psychiatrists and doctors that are in our network that are working a little bit outside of their license and psychotherapists are like, yo, we want to get involved, but where do we go for the meds? And so to your point, there's a whole market segment out there that's just like the opportunist side. I get all these Instagram and Facebook ads now. Like I'm bombarded with this space gummy and polka dot and MK this. And the more you look into these particular products, and I'm not even going to term them as medicine. They're
Mm.
psychedelic products that are in an unregulated market, and most of them don't even contain mushrooms.
Yeah, they
You know,
have 4-MAO DMT,
or
which is ACO, sorry. Yeah, 4-ACO. I'm gonna get it right one day. 4-AC. So why don't you talk about what that is and why it would be substituted for psilocybin or psilocin?
yeah. So this is a Hoffman derived molecule, and this is a research chemical. So for ACO DMT, it can be produced very inexpensively and can be used from a research perspective when you don't have access to cultivated mushrooms. And so in something that's a Schedule One drug, maybe the 4-ACO is going to be better suited to do some of these research studies. And this is the way that it's been used. It does have a psychoactive effect,
Hmm.
but it's a very different effect than taking psilocybin mushrooms. And so it's a little bit shorter acting. It's not quite visual. For some people, they get really nervous and they get some jitters.
Oh.
And in some cases, just based on where you're getting this 4-ACO, I've never seen it, but I know a lot of brands are using it because you do get that psychoactive effect,
Hmm.
not the Schedule One mushroom that everybody wants, the organic stuff.
Hmm.
So there's a legal loophole to be able to sell this stuff bulk. But the problem I have with it is it will give a psychedelic effect, but it's different and it's not mushrooms. And so my only thing, anybody that has these brands that have come out and just say no organic material, contains no mushrooms, contains no mushroom material. You don't have to say synthetic research chemical, which is basically what it is.
Yeah.
That would probably kill your positioning in the market, but at least say on the packaging contains no mushrooms.
Yeah, totally.
So that's where we are. We believe in the ripple effect that psychedelics can have if they're used safely with the right patients, the right customers, ruling out those that aren't right for this at this time,
Hmm.
making practitioners and facilitators are vetted and trusted and safe,
Hmm.
and that the medicine is organic and is dosed appropriately. This is what the PsiloSafe movement is all about. And we believe that it's here from a more therapeutic purpose. The recreational side, buyer beware. If you're
Hmm.
buying drugs in gas stations and bodegas and creme, you're going
Yeah.
to get, hey, look, I'm no stranger to buying some street drugs. I've been around, I've done the raves and the Grateful Dead concerts and
Sure.
fish. But now, if you are interested in the psychedelic movement for the therapeutic purposes of sacred earth medicines being used in conjunction with psychotherapy, this is the crew that you want to get involved with. If you're looking to chomp a gas station polka dot bar and feel a little funny for a few hours, that's cool too. But these things are different. And somebody who's putting 4-ACO DMT into a chocolate bar and saying it's mushrooms on it is antithetical to everything that this movement that we're working on has gone for it.
Allowed.
And I would hate to see like Diamond Shrooms, for instance. It's a brand that just got brought up on an FDA recall. FDA is now testing and recalling black market shroom bars.
Hmm.
Like, but
Yeah.
now it's right. And all we need is one black swan event
Mm.
where a mushroom product
Yep.
that makes no mushrooms kills this whole movement. And then we're back to where we were back in 1969. We have to be very cautious. And I think from PsiloSafe's perspective, and for you and I, people that are in the industry, consumer education is so key.
Yeah.
And then setting up these self-regulating structures and actually just giving a shit
Mm.
about what we're doing out here and understanding the impact that it can have both in a positive and negative way when we make strategic business decisions.
Whether people are listening, just in general, we all like to have a comparison. It helps us understand whether it's science or scenario. So when you think about 4-ACO DMT, if you know anything about Delta 8 in cannabis, so Delta 8 is there's THC 9 and there's THC 8. And Delta 8 is when CBD actually from the hemp plant degrades, it creates THC8. And so that is 60% has 60% of the psychoactive effect of the THC that we walk into a dispensary to purchase. When it degrades in such a small amount, there's actually no way for the Delta 8 that we purchase online or at gas stations to be anything but synthetic, right? So you're talking about a synthetic when it comes to Delta 8. You're talking about always going to be a synthetic when it comes to 4-ACO DMT. And as we discussed earlier in the conversation, it's always better the closer you are to the natural compound, right? So you're just not going to have the experience really that you've been sold, right? By the headlines, hey, this mushroom, psilocybin mushroom can change your life. You're not going to get that out of this synthetic. I'm curious if you think, you said you've never seen
For ACO, I just wonder if it's crystal or powder or liquid in terms of cross contamination with fentanyl. It's powder. Yeah, that's not good.
The fentanyl epidemic is
Real.
a now, and so that is a
Yeah.
potential. I think that the potential for harm with that would be these bulk producers that are using
Right.
different inputs to create it or different solvents in the process. And so I think that's where we're really going to see, again, there's no standardization. With the mushroom, it's growing from earth, from your substrate, pretty hard to mess that up. But as long as it's been handled properly and there's no mold on it or
Really. Yeah.
any mold, you're good. But dealing with
Yeah.
a recent chemical that's probably coming in from China in bulk, I'm not interested in it. I've got a little vial of it in my place, but it was just given to me as, hey, what if anybody wants to try this out? Because again, there's a huge market for it. So many bulk manufacturers of these products that are putting it in there on the Instagram. That doesn't contain any mushrooms.
So if they're selling Delta 8 at this store, they're probably selling this, is what
Yeah.
I think, right? It's the same loophole.
Well,
Yeah.
Delta 8 THC is a very similar loophole, except that's
Yeah.
actually hemp and running a chemical process on it to make the non-psychoactive CBD psychoactive with THC Delta 8. And so there's another loophole there. It's just people with different analog loopholes and different drugs will continue to go down these rabbit holes forever because they don't want to be the target of law enforcement.
Yeah.
What I right now is that in the mushroom movement, that it's not a target of law enforcement. I don't think law enforcement has the time, effort, energy, or resources to go after people that are using earth-based medicines for mental health and wellness. I think where you're going to see some law enforcement come in would probably be with this 4-ACO stuff.
Yeah.
Now that the Diamond Shroom situation and the FDA recall is now on the map, I would say trying to take a closer look at the producers of those products that are selling through the bodegas. I was down at the Fremont Street Experience in Las Vegas a couple months ago when we were out there for the PsyCon conference.
Hmm.
Crazy. It was just like shrooms, mushrooms. And you would go into those places and they would have probably literally 10 or 12 different brands, chocolates, gummies, some cool beverage type stuff. And
Hmm.
I asked the person that was working the counter there straight up, I said, do any of these products that they're bringing people in with a huge sign that says mushrooms in color. I'm like, any of them actually contain mushrooms?
Mhm.
And he said, only this one right here. They'll shoot you straight. At least in that case, the only one contained a non-detectable version of psilocybin extract, detectable extract that's being used out there for product production, which I would back that 100 times more
Okay.
than any of the 4-ACO products. But again, this is where we're at. So from a law enforcement perspective, microdosing and small sub or mildly perceptive, it's not an issue. It shouldn't be an issue. There's so many other things out there. Law enforcement only has so many time and resource between the fentanyl epidemic and guns and terrorism and AI scams and child
Yeah.
trafficking.
Yeah.
This
We've
is,
got some.
I think, moving in a way that's mindful with safety, making sure you're staying out of the hands of children, making sure you're ruling out people with predisposed issues that shouldn't be on psychedelics. If you're involved in the movement, you should be just fine if those things are being taken care of. And you're not out there trying to exploit the movement, driving some crazy car or trying to ride the wave for very obvious personal benefit. We're in the right space.
Can we
To
talk
free,
about the testing?
this goes back to PsiloSafe. Test them for potency. They're consistent. People are taking them in the morning, jumping on Zoom calls, going to work. Either they would prefer the sub-perceptual dose where they're not feeling anything, or the light perceptual dose where they're feeling a little something. And then a hot batch of mushrooms that were pretty potent. That was a different experience, and that caught a couple people off guard. The importance of testing the mushroom material before it goes into any manufacturing process.
We hear this term functional mushrooms a lot.
Nootropics and adaptogens that are used in conjunction with a microdosing protocol. You don't want to take a microdose every day, obviously, right? You want to take it every other day or every fourth day, depending on whose protocol you're following. But having that enhanced or having that some other functional mushroom product that they can use on the dosing days off is a
Mhm.
good way to keep people dialed in. And there's just so many benefits overall, physically, spiritually, psychologically, to just the functional stuff without the psychoactive, that it provides a really good adjunct.
Joe is definitely a person that is spreading the good word in the industry and starting to get some attention.
Nobody, me included. I've been close to the medicine since I was in college. I did 3 shamanic led, very high dose journeys when I was living in Bali in 2018 and 2019. I worked with a shaman over there to conduct those at my own villa. That really got me into it for non recreational purposes, but for real therapeutic purposes. And then microdosing has helped me out personally. I think that everybody wants to shit on pharma, but I think there's a place for pharma. I just also think that there's a place for organic substances, earth-based medicine that are used in community-based settings. PsiloSafe is here to help perpetuate the safe growth of those community health-based, mental health-based initiatives. We've got about 10 brands that are in the PsiloSafe network. We're so eager to learn and share best practices and like, where are you getting your stuff tested at, and what potency level are you manufacturing your capsules with, and what device you're using to manufacture your capsules, and do you have a good gummies producer that can produce pectin-based vegan gummies that are low sugar? Clients really want those. How do I label this stuff? What type of warnings do we need to have? When does it go bad? Should I have a born on date on my packaging because mushrooms do degrade? So
Yeah.
we're trying to wrap a big bow about what we talked about today, but this is why we're in it. And eventually you do good work, you'll make a living out of it. And I know that will happen eventually. And I don't deter anybody from making a good living, especially when there's a karmatic component here where we're actually helping people and then we're making. But that's where we're at right now. My main objective is softening this market and educating this market so that we can launch in the most ethical, impactful way possible. Consumer education, producer education, PsiloSafe certified. Let's go.
That's right. I'm really happy to know you. I feel like really, yeah.
From the jump, just such a solid connection.
Yeah. Yeah. Thank you so much.
Thank you for joining us for today's show. I'm April, and I'll be back the next installment of SetSet Show, where we cover everything you need to have a safe, supported psychedelic experience in the wild.